Right, so first step before suctioning, we're going to make sure that our patient's not in any respiratory distress. If they're using oxygen and they tend to desaturate with suctioning, we can go ahead and hyperoxygenate them beforehand for 30 seconds to a minute. If they're just on humidification with 21% room air, or they have an HME, then we don't need to hyperoxygenate. So I'm going to go ahead and turn on my suction. For children, it's 80 to 100 millimeters of mercury. For adolescents, it's going to be 80 to 120 as needed, but higher is not necessarily better. So I'm going to go ahead and start prepping my suction tray. It comes with a pack of sterile gloves, so I'll open those up. And then you're going to get either sterile saline or sterile water, and you're going to put it inside of your suction catheter kit so that we can clear out the secretions. I usually put 2 saline bullets at least. And it's no longer recommended to insert drops of saline into the trach, but that was a practice before. So now I'm going to go ahead and put on my sterile gloves. We'll keep one hand sterile. Your dominant hand will be sterile, and the other hand will just be our clean hand. To determine the size of the catheter for suctioning, you're going to look at your trach size. So this is a 3.5 neo-Shiley. So if I do 3.5 times 2, that's 7. We don't carry 7 French catheters, so you can either do a 6 French or an 8 French. So this is 6 French. So I attach here to our suction catheter, and we only want to touch the catheter with our sterile hand. With our other hand, this is where we're going to actually apply suction here by occluding this hole. I'm going to go down to the depth of my suctioning. So for this size trach, I checked beforehand how deep the depth of the trach is, and it goes just the length of 5.5 centimeter or 5.5 markings. So I'm going to go ahead and lubricate first. To lubricate, you're going to put the catheter in the tray and just take up a little bit of saline just to make it easier for secretions to go through. So I have my fingers at the 5.5. I'm going to go all the way down without occluding suction. Once I'm at my 5.5, I can go ahead and occlude, and I'm just going to roll the catheter between my thumb and index until I'm all the way out. Then go ahead and assess your secretions, and you can clear them by applying suction in your little kit here. And make sure that our patient's saturations are still good. I have my oxygen set up and my ambu bag nearby just in case. Again, I'm putting my fingers at the 5.5. I'm going down without occluding suction, and now once I'm in, I'm occluding suction, rolling between my fingers, and the maximum amount of time that you want to stay in the trach with suctioning is 15 seconds, just to prevent them from desaturating and occluding their airway. Right, again, we're assessing the secretions, and I'm going to go ahead and clear them with the saline there. And then last thing, some patients are going to need some extra oxygen after suctioning, so you can hyperoxygenate afterwards if they're looking like they're having some difficulty breathing, if they're coughing, or if you notice that they're desaturating. And that's it.